Every year. The medical term for the condition is called thrombosis, and today is World Thrombosis Day. We are joined this morning by Dr. Jean Connors, a World Thrombosis Day Steering Committee member, as well as YouTube sensation iJustine, known for her YouTube channel iJustine, to discuss her experience with blood clots as well as remission. Welcome to you both.
Thank you so much for having us. This means a lot.
Yeah, it means a lot to us as well to share this information. Dr. Connors, I want to begin with you. For those who are not familiar, what is thrombosis?
Thrombosis is development of a blood clot. Like when you cut yourself and you get a scab on the outside of your skin, that's a blood clot. People can develop these blood clots within the blood vessels, and that blocks the blood flowing to critical organs and critical sites.
Are there any risk factors for that? And if so, what are they? What should people look out for?
So there are a lot of different risk factors depending on the setting in which you're in. Things like infectious diseases, inflammatory diseases. We know that COVID for patients in the hospital have increased risk for blood clots, being overweight, smoking, having cancer, and Justine's unique experience, which I'll let her describe.
Justine?
Yeah, so it was very interesting, and I'm really excited to be able to be this U.S. patient advocate this year for World Thrombosis, because it was something that before this I had no idea about. And my specific diagnosis was called thoracic outlet syndrome. So it's because there's a rib that was pressing on the vein, which caused a blood clot. And I'm super active. Even that day that I got it, I had run 7 miles that morning. And then the next thing I know, I'm in the hospital. So it was a very scary experience. And the fact that this could happen to me, who I seemingly am young and healthy, and the doctors kept reiterating that, it can literally happen to anyone. And I think that's what's so scary about this, the fact that it can be a cause of death for 1 in 4 people. And that's a really scary statistic.
Justine, we're watching some of the video here of you in the hospital. What were the symptoms you experienced during that first episode?
The initial one was my arm just started to swell, and I ignored it for like 2 days, but then it got so swollen and it started turning colors and the veins started breaking in my shoulder. And that's when I knew something was definitely wrong and I should have listened to my body a little bit earlier and went to the doctors. But thankfully I did go and I made it in time, and they were able to, thankfully after 5 days in the hospital and 2 in the ICU, they were able to remove the clot. But the clot actually did travel to my lungs, which is what's so dangerous about these clots, because they can travel. They can travel to your lungs, to your brain, they can cause strokes, and it can happen so quickly. So it's so important to know the signs. If you feel something is not right, get to a medical professional to get assessed immediately.
And we're so thankful too, Justine, that you're sharing your story even via YouTube for people out there. How are you doing now?
I'm good. I mean, there isn't a day that doesn't go by that if I feel some sort of pain or something weird in my arm, I'm like, is it coming back? But knowing those signs and knowing that I have doctors basically on call, and it is rewarding and very refreshing to know that I am able to share this story, because if this can help someone else who is in a similar situation, who maybe thinks that they can just continue to ignore it, please do not ignore the signs, because it really is imperative that you get the medical attention that you need. And the earlier that you catch it, the better off it is for your, the outcome.
Well, Dr. Connors, we talk about the signs, but if you do have a blood clot that goes to the brain or the lungs, we know that that can be fatal. So should people start going to their doctors and getting tested maybe before something happens, or how can you kind of prevent it if that's even an option?
Well, that's an option in many situations. And I think one of the things that World Thrombosis Day is doing is bringing awareness to people and providers to look for the risk factors and do a risk assessment before the blood clots occur. As Justine experienced, slowing down of blood flow from compression is often a side effect. But things like lipid profile, high blood pressure, smoking can affect the blood clots that occur in the brain. Obesity, cancer, inflammatory and infectious diseases, often patients with lupus, rheumatoid arthritis, inflammatory bowel disease, all have risks for thrombosis that they never even considered. So discussing with your primary care physician or your specialist before a clot happens and taking the steps that you can to prevent a clot is important. For people who are listening, we would direct them to worldthrombosisday.org, our website, which has a lot of patient-centered and patient-friendly information to give people more information about the signs and symptoms of blood clots and steps they can take to prevent them themselves.
Well, thank you so much, Dr. Connors, and thank you, Justine, for your story. We appreciate it.
Thank you so much for letting us share this.
Absolutely.
Yes, thank you.
Take care. Holly.
All right, 10 minutes before the top of the hour right now, and still to come, a local 17-year-old